The World Health Organization describes mental health as the subjective well-being, perceived self-efficacy, autonomy, competence, intergenerational dependence, and self-actualization of one's intellectual and emotional potential, among others. Simply put, mental health refers to the psychological well-being of a person. When WHO conducted a study in 2010, they found that 6.5% of Indians suffered from various serious forms of mental health disorders, with not many differences between the urban and rural populations. As of 2012, mental health professionals are reportedly as low as 1 in 100,000. As of 2016, the average suicide rate in India was 16.3%. Stress is a natural, biological response to demanding situations. When the physical and mental effects become perpetual, it is called chronic stress. Chronic stress may be caused by high-pressure jobs, financial difficulties, or challenging relationships, with feelings of helplessness and lack of control. This kind of high levels of stress can have serious health complications such as mental health problems, cardiovascular diseases, and eating disorders. Feelings of loneliness and isolation affect all types and ages of people, with adolescents and the elderly at high risk. Research indicates that more than 20% of people over age 60 frequently feel intense loneliness. Feelings of isolation can have a serious effect on one's health. Loneliness can be a risk factor for heart disease, type 2 diabetes, and arthritis, among other critical diseases. Lonely people are also twice as likely to develop Alzheimer's disease. Loneliness can be a chronic stress condition that ages the body and causes damage to overall well-being. The media has consistently portrayed romanticized versions of mental health issues that require serious attention, with terms such as schizophrenic, autistic, and psychotic being commonly used. This has led to a culture where people associate certain behavioral traits with mental disorders. Obsessive-compulsive disorder is a common, chronic, and long-lasting disorder in which a person has uncontrollable, recurring thoughts and behaviors that he or she feels the urge to repeat over and over. Frequent mood swings do not mean that one has bipolar disorder. Bipolar disorder is a mental illness causing dramatic shifts in a person's mood, energy, and ability to think clearly. People who suffer from it experience extremely high and low moods which differ from the typical ups and downs most people experience. Depression is not someone having an off day, but rather a mood disorder characterized by constant low moods and feelings of sadness and loss of interest. It is a persistent problem, generally lasting 6 to 8 months. Mental health, although increasingly recognized today, is still treated with a fair amount of stigma, resulting in people keeping issues with their mental health to themselves. The solution to removing the stigma is to spread awareness and the importance of understanding issues people could face with mental health. This could be done by encouraging people to be conscious of their attitude and behavior, being sensitive when talking about mental health, and providing a supportive outlook to those with mental illnesses. It is not always easy to detect mental illness, but it can affect someone's daily life in different ways. Some things to look out for may include low or sad moods that last for extended periods of time, the inability to concentrate, extreme feelings of guilt, fear, or worry, sudden, dramatic, and explosive mood swings, constantly feeling tired, sleeping and or eating too much or too little, and suicidal thoughts. Mental health is often put on the back burner as people tend to focus more on work, family, studies, or social commitments. Sometimes, educational institutions and caregivers neglect mental health and its importance. In 2018, the World Health Organization reported that depression is the world's leading cause of disability and affects over 300 million people. Over 13 million deaths could be avoided if underlying mental illness problems were addressed, further increasing the need for people to prioritize their health, both physically and mentally. It is necessary for someone to have a good sense of mental well-being in order to function properly. Most people who experience mental health problems recover fully or are able to live with and manage them, especially if they get help early on. Good health isn't limited to the physical well-being and largely involves one's mental well-being. In honor of World Mental Health Day, the Manipal Journal would like to introduce its newest video series, the Mental Health Series, where we discuss all things mental health related in Manipal.